What happens to your libido when you have low testosterone? Low libido in men is often an overlooked issue, but its physiological roots run deep. It's not only about psychological factors, there are clear biological explanations that influence sexual desire. In this video, we'll explore the 5 main causes behind low libido in men and 5 evidence-backed ways to improve it. Let's dive in. 1. Low testosterone levels. Testosterone, the primary male sex hormone, plays a crucial role in regulating libido. Produced mainly in the Leydig cells of the testes, testosterone synthesis is governed by the hypothalamic pituitary gonadal (HPG) axis. The hypothalamus releases gonadotropin-releasing hormone, GnRH, which signals the pituitary gland to secrete luteinizing hormone, LH. LH then prompts the testes to produce testosterone. When testosterone levels drop, libido typically follows suit. Testosterone levels naturally decline with age, but several other factors, such as obesity, diabetes, and conditions like hypogonadism, can also contribute to lower testosterone. When testosterone is insufficient, it impairs nitric oxide production, which is crucial for blood vessel dilation. Without adequate nitric oxide, achieving and maintaining an erection becomes increasingly difficult, leading to a loss of sexual desire. Research shows that low testosterone levels are linked to erectile dysfunction and decreased libido. In fact, a study published in the Journal of Clinical Endocrinology and Metabolism found that testosterone replacement therapy in men with low levels resulted in improved sexual desire and function. Additionally, lifestyle changes like weight loss and exercise can help naturally boost testosterone levels. 2. Chronic stress. Stress is another common cause of low libido in men. Chronic stress triggers the release of cortisol, a hormone produced by the adrenal glands. While cortisol helps the body manage short-term stress, prolonged high levels can suppress the HPG axis, leading to reduced testosterone production. Stress also increases the activity of enzymes like 11-beta-hydroxysteroid dehydrogenase, which further inhibits testosterone synthesis. As a result, men under constant stress may notice a significant decrease in sexual desire, with days or even weeks passing without any inclination toward intimacy. One real-world example is the impact of high-stress professions on libido. Studies have shown that men in high-stress occupations, such as first responders or high-level executives, report lower testosterone levels and diminished sexual drive compared to their less stressed counterparts. Managing stress is key to restoring hormonal balance and boosting libido. 3. Sleep disorders. Sleep is essential for optimal hormonal regulation, particularly testosterone. Deep sleep, stages 3 and 4 of the sleep cycle, is when the body produces the majority of its testosterone. Disorders like sleep apnea or insomnia disrupt these stages, leading to reduced testosterone levels and, consequently, lower libido. A study published in JAMA found that young men who restricted their sleep to just 5 hours per night experienced a 10 to 15% decrease in daytime testosterone levels. Chronic sleep deprivation can lead to long-term hormonal imbalances, significantly affecting sexual health. 4. Medications. Certain medications can negatively impact libido. For example, selective serotonin reuptake inhibitors, SSRIs, like Zoloft, which are commonly prescribed for depression and anxiety, can inhibit dopamine production. Dopamine is essential for sexual desire, so when its levels are low, libido can take a hit. If you experience a drop in libido due to medications, it's crucial to speak with your healthcare provider. Sometimes, adjusting medication or switching to alternatives like Wellbutrin, which has fewer sexual side effects, can help restore libido. However, always consult a doctor before making changes to your medication regimen. 5. Relationship issues. Emotional and psychological health plays a significant role in sexual desire. Tension in relationships, unresolved conflicts, or emotional disconnection can decrease the release of oxytocin, the bonding hormone, and dopamine, the reward hormone. This results in reduced sexual desire. Experts, like relationship therapist Dr. John Gottman, recommend simple but effective practices to restore intimacy in relationships. One of his strategies is the 6-second kiss, which fosters emotional bonding and stimulates the release of oxytocin. This simple act can go a long way in improving not only emotional connection, but also libido. Boosting libido. 5 evidence-based strategies. Now that we understand the causes of low libido, let's explore 5 practical ways to boost it. 1. Exercise regularly. Physical activity is essential for a healthy libido. Exercise stimulates the release of insulin-like growth factor 1, IGF-1, which enhances testosterone production. Additionally, regular exercise improves blood flow and overall vitality, which are key components of a healthy sex drive. 2. Improve your diet. Certain nutrients are critical for testosterone production. Zinc, for example, is essential for maintaining penile endothelial function, while magnesium improves free testosterone by slowing down the binding of sex hormone-binding globulin, SHBG. Incorporating foods rich in these minerals, such as spinach, pumpkin seeds, and oysters, can support libido and testosterone levels. 3. Stress management. Managing stress is crucial for hormonal balance. Practices like yoga, meditation, and Tai Chi can help lower cortisol levels, promoting better testosterone production. Spending time in nature, known as forest bathing, has also been shown to reduce stress and improve overall well-being. 4. Improve sleep. Hygiene. Quality sleep is essential for optimal testosterone production. To ensure deep, restorative sleep, try removing all electronic devices from the bedroom and establishing a relaxing bedtime routine. Reducing blue light exposure before bed can help regulate sleep cycles and improve sleep quality. 5. Consider supplements. Certain natural supplements like saffron and tongkat have been shown to support testosterone production. However, it's important to consult with your doctor before introducing any new supplements into your routine to ensure they are safe and suitable for your needs. Conclusion. Low libido in men is a complex issue with both physiological and psychological roots. Understanding the underlying causes, such as low testosterone, chronic stress, sleep disorders, medication side effects, and relationship issues, can help identify effective solutions. By incorporating lifestyle changes like regular exercise, a balanced diet, stress management techniques, improved sleep hygiene, and considering supplements, men can take proactive steps to boost their libido and enhance their sexual health. It's important to remember that small changes can lead to significant improvements, and seeking professional help when needed is always a wise choice. By addressing the root causes of low libido and taking action to restore balance, men can regain their vitality, confidence, and sexual desire.